Hello, good morning, and welcome to my channels. My name is Violet Okoloja. How are you doing? I'm super excited. All right, guys, I know we are all fine, and I want to say massive congratulations, or big congratulations rather, to as many who passed their OSCE exams. So, guys, keep passing your OSCE exams. All right, guys. So, we're going to continue the series we've started because obviously, I'm really so excited with your support. So I said, anything you want me to talk about, pop it up and we'll be talking about it. And like I said in the last video, somebody talked about care plan for ectopic pregnancy and congestive cardiac failure. So we'll be talking about congestive cardiac failure today because we've talked about ectopic pregnancy care plan in the last video. So guys, let's get started. And before we do that, if you have not subscribed, guys, please encourage me. So subscribe, hit on the notification button so that you get updated when I post a new video. And don't forget to share with your friends. Keep your comments. I'm always happy to read your comments. Now, for congestive cardiac failure, to be honest, it comes with a care plan. I will say, people will say, how? You see, they'll just tell you, patient or Mr. A presented with a facility with shortness of breath, with difficulty in breathing. Patient is not able to carry out activities of daily living. Patient cannot, patient has no appetite to eat. And patient is a known heart failure patient, or patient is a known congestive cardiac failure patient. Guys, once you see that, from what I've told you now, there are more than 5 care plans there. Yes, there are more than 5 care plans. So for congestive cardiac failure or for any heart failure, you may want to consider shortness of breath, difficulty in breathing, activity intolerance, risks for malnutrition, and anxiety. For anyone you present with, all those are the pointers. All these are the pointers. So for today, in today's video, I'll be talking about Mr. A. It's having difficulty in breathing due to CCF or due to heart failure. And what will be my aim of care? Aim of care, patient will verbalize ease in breathing. Patients will verbalize ease in breathing. Now, to be honest, it actually depends on your assessment. For some, doing your assessment, the patient is having difficulty in breathing quite all right, and yes, respiration is high. So you could use Mr. A is having difficulty in breathing, evidenced by respiration of 24 or respiration of 25. But even if you don't say all that, Mr. A is having difficulty in breathing. And what is causing that difficulty in breathing is the congestive cardiac failure. So if you use Mr. A is having difficulty in breathing due to congestive cardiac failure, you are good to go. You don't need plenty grammar. To be honest, OSCE exam, the simplest of the simplest is planning. And what will be my aim of care? Mr. A will verbalize ease in breathing. That's simple enough. Reevaluation date to be reevaluated today, every hour, and as the clinical condition changes. It's really that simple, guys. E. Explain and discuss all aspects of care to Mr. A and gain consent for all intervention. M. Now, remember I said it depends on your news score. So let's assume my patient is having a news score of 8. So I will say monitor and record Mr. A observation continuously and escalate as per news 2 policy. Simple. A. Assess. What are we assessing for? Assess Mr. A's breathing pattern, assess his respiration, assess his skin color. You have to assess all that because it's a congestive cardiac failure. So you have to assess patient's breathing pattern, the rate, the rhyme, the depths. You have to assess his skin color, and you have to assess his SpO2. Yeah, you have to assess the saturation level. And we're done with assessment. The next thing is teach. Teach breathing exercises and adequate positioning to promote lungs expansion. That's simple, yes. That's simple, guys. And A, administer all prescribed medication and monitor its effectiveness after 30 minutes. Really simple. Yes, an arrow. Who do you refer patient to? Refer patient to cardiologist because obviously it's a cardiac patient, or refer patient to the medical team. Inform patient to use the call bed, that's I, and document all care as planned. You know, guys, using e-matari makes your care plan super easy. So if you are like, why are you so fast with the care plan? Don't worry, guys, just go to my other video on the use of e-matari. Once you know e-matari, for all care plan is just copy and paste. Tick. Now, self-care. So everybody should be giving me one self-care. One self-care. All right, so for self-care, patient verbalize understanding of his treatment plan, number 1. Patient consents to treatment, number 2. Patient participates in his plan of care, number 3. Patient is able to use the call bed, number 4. Patient understands reason for referral, number 5. Patient tolerates medication, number 6. Patients can perform deep breathing exercise, number 7. But you don't need up to 7 self-care, to be honest. If you have 3 or 4, you're also good to go, guys. 3, 4, or 5, you're good to go. And somebody will say, what will be your second care plan? For any cardiac problem or for any heart problem, obviously, you know, there's fatigue. Activity intolerance. Mr. A is experiencing activity intolerance due to heart failure or due to congestive cardiac failure. Aim of care. Patients will participate in activities of daily living within the limit of his disease condition. Yeah, because we know his heart issue. The heart is not functioning the way it should. So the patients will be fatigued and easily get tired. So our aim of care, patients will be able to perform activities of daily living within the limit of his disease condition. What is our reevaluation date? To be reevaluated today, every hour, and as the clinical condition changes, guys, is the same e-matari. Explain and discuss all aspects of care to patients and gain consent. Monitor and record Mr. A observation continuously. Don't forget I said probably the patient had the news of AIDS, you know, continuously, and escalate as per NIS 2 policy. Hey, what are you assessing for? Assess patient of activities of. What are you assessing for? Are you assessing for the level of fatigue and the ability to carry out activity of daily living? So that's what you're assessing for, obviously. And remember, for the difficulty breathing, I say assess breathing pattern, assess skin color. So now, because we are dealing with patients experiencing activity intolerance due to congestive cardiac failure, what are we assessing for? We are assessing for, you know, ability to carry out activities of daily living, and we're assessing for what? For fatigue. Then the next thing is what? Teach. Teach and assist patients to carry out activity of daily living within the limits of his disease condition. It's that simple. A, administer all prescribed medication, you know, and monitor its effectiveness. Arrow, refer patients to OT/PT, because obviously this is a patient that is really tired, easily tired, and needs mild and moderate exercise to be able to, you know, carry out his activities of daily living. So you're referring patient to OT/PT for the assessment, you know, and you know, you inform patient to use call bell, and you document all care as planned. What a simple exam, guys, you know. So that's how easy it is. And for self-care activities, patient verbalize understanding of his plan of care. Patient consents to treatment. Patient is able to participate in his plan of care. Patients can tolerate medication. Patients can carry out activity of daily living within the limit of his disease condition. Patient can use the call bell. Patient understands the reason for referral. Okay, guys, but don't use patient. Oh, you have to use Mr. A or Mrs. A. You know, that's how we should be doing, because you have to be specific to show that you are meeting the patient's needs. So, guys, it's really, really simple. And endeavor to sign. I usually advise sign before you start your care plan. It's really that simple, guys. So I will be expecting you to do other care plan for me. Like shortness of breath is another one to be considered. Yes, anxiety, risks for malnutrition. So guys, it's just for you to read your scenario very well. Once you get glued to your scenario, you see they are so easy and simple, guys. Thank you so much once again for your support. I'll be waiting to do more videos for you. However, I'm already working on back-to-back clinical skills. So very soon you'll get all the clinical skills on my channel. I'm really working on that. So until then, guys, keep passing your OSCE exam and don't forget to subscribe, hit on the notification bell just to be in line and in tune with my channel. Thanks so much, guys. Have a lovely day. Bye.